In this video, we'll demonstrate active range of motion of the cervical spine using inclinometers. So we'll test the patient's range of motion using 2 inclinometers in cervical flexion, extension, and lateral flexion, but we'll use 1 in cervical rotation. So with the patient seated, I'll apply 1 inclinometer at the top of the head and 1 at T1. I'll zero both out before we begin, and I'll have the patient simply bring his chin to his chest. I'll note the range of motion, and he'll go ahead and reset, and I'll re-zero out the inclinometers. For cervical extension, I'll place the inclinometers once again at the top of the head, and 1 at T1, but this time with the bottom one at T1, I'll bring it a little closer towards me so he can actually bring his head back and give him room. Once again, he'll bring his head behind him and look up towards the ceiling. I'll note the range of motion here, and then zero it out, and he'll reset. I'll also ask the patient if there's any pain or discomfort when doing so. With lateral flexion, I'll place the inclinometer on the top of the head, and again at T1, this time with the inclinometers facing me, and I'll actually be behind the patient this time. And he'll go ahead and touch his right ear to his right shoulder. Again, I'll note the range of motion for cervical flexion to the right. I'll zero it out, and then he'll bring his left ear to his left shoulder. And again, I'll note the range of motion for left cervical flexion, cervical lateral flexion. I'll zero that out. Once again, also asking the patient if there's any pain doing so. And then for cervical rotation, I'll have the patient lay on his back on the table, facing the ceiling. And again, with cervical rotation, we're only going to use 1 inclinometer. I'll lower the headpiece just a little bit for patient comfort. So we'll place the inclinometer facing me, and I'm going to zero it out. I'm going to place it on the eyebrow, above the eyebrow of the side that I'm not testing. So for rotation to the right, I'll actually have him rotate to the right, and I'll carry and stabilize the inclinometer with him. And I'll note the range of motion there. Zero it out. And then for left rotation, I'll put it on above the right eyebrow, stabilize it there, not pressing too hard, but pressing gently and firmly. He'll rotate to the left, looking over his left shoulder. I'll follow the inclinometer with them, and I'll note the range of motion for left rotation of the cervical spine. Also asking the patient if there's any pain or discomfort with doing so.